Hi, I'm Dr. Sally Foote. I'm a veterinarian and animal behaviorist, and I have over 35 years of veterinary practice experience with a niche interest, specialty in not only animal behavior, but especially low-stress care for animals. Today's Facebook Live, I'm going to talk about the success story of a dog who, with a client, their owner, that within one visit, I provided to the client as well as the primary care veterinarian using telehealth veterinary behavior services the behavior cocktail, the right mix of what pre-exam medication, drugs or medications could be added to this dog's already medication plan she was on, specifically for the client, what to practice, like what to set up for her and the vehicle to get to travel, to try traveling to the vet, doing like a dry run, as we call it. We'll give this one a dry one. How the clinic had a specific time, got the areas set up for where we pre-planned, where the dog would arrive, where she would come in. The staff was trained, and communicated as far as let's keep it quiet, etc. for this dog. So this was a 5-part plan I've talked about. And what started the best was how this dog arrived and she was calm and that. So the story is this dog, she's a young German Shepherd dog. And about a year and a half ago, there was like a loud vehicle that went down her street with some other things. She was a little bit nervous and she just panicked. She ran all the way home. She would not get out of the home. So that sets a very firm memory for her about vehicles and being outside and being in a state, frankly, of like panic that she could not improve on. So with some medication and doing a lot of counter conditioning, etc. at home, she had really improved a lot with being able to go outside and play, being able to go out for like short leash walks in quiet areas. But the concern of the client was, what is going to happen when I need to take her to the veterinarian, like she needs care or she has an urgent situation, she's sick, because she's at this point, there is no way that she was even going to could be calm despite multiple attempts of medication for trying to even back out of the driveway or ride in the vehicle. And I agreed. I said, yeah, that's a really valid concern. And yes, we can make her, as my wonderful technician would say, so drunk she can't remember how much she doesn't like to travel and arrival at the vet, as a way of resetting memory. So in my services that I do with my telehealth veterinary behavior services, I emailed the primary vet and I were emailing and I said, this is what I'm going to suggest as the added medication for this vet exam that is going to have her be somewhat sedate. We're going to have to get her to a level of being sedate, as well as reducing the anxiety even more, because we know she's going to be triggered for vehicle travel. There was no house call veterinarian who could come to his house. Yeah, house call vet, that might be good. That's not really something that was available. So prior to even trying it, okay, remember that 5-part plan, we got to have the client help with prepping the animal, not only with the medication, but how are we going to travel? What is the route, etc. And then at the exam clinic part, the time of day for scheduling and where we're going to have the dog come in, etc. So this is how the success story went. This was in one visit. This dog was able to get a full physical examination, vaccination, and blood work. And the client was really, sorry, we keep connecting and reconnecting. We're having a little bit of difficulty here, but I'm just going to keep plugging away. Okay, so the client I recommended, frankly, when I discussed with a primary care vet, adding acepromazine and alprazolam to her existing, she was on a current chronic medication, but adding acepromazine and alprazolam. And the reason why is remember, ACE always needs a buddy. Acepromazine is fine to use, yet it has to have an anxiety-reducing medication. So this may be an alprazolam. It reduces the anxiety. So when the two are given together, that's the key. They must be given together. That's where you have the sedation effect from the acepromazine, but the anxiety reduction benefit from the alprazolam. So he had the 2 medications, but before giving that, I asked him, send me a video of the outside of the property, of the veterinary property, and the route that you can drive to go to the veterinary clinic, because I wanted to know and to give him the plan for what route you should take to eliminate and reduce the triggers that she might see in the vehicle, because it will get her up to pacing, whining, digging, and that would have her too agitated and override the benefit of the medication. So over the weekend, he took videos of his drive into the vet clinic and some choices of the routes he could take. And the clinic was closed, and that's fine. He had the video of the front of the building, the side of the building, which ways, he could be around the building. And then he and I, we had a short video, consult where I said, okay, here's the plan. The veterinary clinic already had him scheduled. They already, from my communication with the primary care vet ahead of time, they had him scheduled for a trial exam at 8 o'clock in the morning before any clients are going to be pulling in the parking lot. He'll be the first one seen. And they do not start their regular appointments till at least 9 a.m. So this way, there was surgery drop-offs, but that would not be a lot of traffic around the front door. So when talking to him and seeing the property, and prior to talking to him, I did actually call the veterinary clinic and double-checked on where I could see coming from this, arriving maybe at the side of the building. Did they have an entry door? Yes, they have a cat entrance. And the staff was thinking about maybe it'd be better to come in the cat entrance. And I agreed. And I said, yes, on the side, the cat entrance. And then the staff told me, well, there's a way around the back of the building where there's a yard, but there's the dog boarding facility, although there is kind of that mesh screening, they won't see each other. And then the tech said, but there's an air conditioner out there. This is in the South. These are the clients in the South. And I said, okay, so the air conditioning would be a loud noise trigger. See, the staff they're trained, they're thinking ahead this way. Love that. And so in discussing with the staff, I said, all right, I'm going to be talking to the client, but let's plan on him pulling up, coming to the side door, position his car to be parallel to the wall to create kind of a block of anything, visual and loud, noise-wise. And if we can have, as long as she is not, and I refer to this ladder of panic, my canine ladder of panic, you can download this off of my website under the veterinary resources page. I said, as long as she stays below the level of shaking, trembling, or pacing, she may have her head down. She may have her tail down. No, she's not happy. But if she's not rising up past this threshold of panic, we do need to get her to at least experience coming in here once. And at that level, we will not do anything more. She will not get any vaccination. She'll not get any blood draw. But at least she's got to arrive, and then she's got to leave to get some kind of baseline started. Fine. Staff understood that. They agreed. And so when I talked with the client, I reviewed this with him, and he said, sure. And I said, so keep the appointment at 8 o'clock, and frankly, we're going to take it as a dry run. If she gets, and I outlined for him as well, if she gets up to a point of like shaking, trembling, or pacing in the car, you're going to turn around and go home. You're not going to continue on. You're going to be tossing her chicken in the back. She won't eat it. Okay, but if she's at that high, we're going to have to stop there, and we're going to do a couple of dry runs with the medication, okay? If you get all the way to the vet clinic and she has not started shaking and trembling, great. So you get her out of the car. Let's then see, how does she enter through the entrance? And in this case, through the cat door was an immediate exam room, and the plan was go into that first exam room, that immediate exam room. So we're not going through the hallway. And the staff knew this was part of the plan I'd outlined. We will not be having staff all around. They will not be talking a lot. We're going to keep it quiet. There would only be the doctor. There would only be maybe one, assistant technician if needed. No reaching for this dog, tossing any reward, just as seeing if she might take it. Any kind of, if she's calm, she's maybe taking the food reward, she is not trembling, shaking, or pacing, then they could go ahead, always approaching from the side, do maybe just one pass over the body, touching the body. If she accepts that, then go ahead and see how, give her the booster vaccination, where then we'll lead the dog forward, the vet or the shot administrator goes aside to minimize all touch, minimize all handling, so that we don't overstimulate this dog or push her up to panic. The other tips I did, which the staff followed, was covering that stainless steel exam table with a blanket. I mean, like a dining room table, tablecloth. Like this dog, we've got to strip away all triggers. I did not know all the trigger lists, so I just said, what commonly triggers the dog is the noise, the shiny stainless steel table. Even if they're not on it, just seeing it is enough. So they did these things. client, even before going, said, you know, she likes, how about if I put this leash that'll help hold her to the seat so she's not trying to pace around? I said, actually, that's a good idea. Do that, because the pacing and moving around the car is not a good idea. And taping paper on the back window so she won't see everything as they were going to be driving down the road. And so this morning, I got a wonderful text from him, and he was very, very happy because he gave her the meds 2 hours before leaving on an empty stomach, so that way they have most benefit. Had her favorite chopped chicken treat, and he said she jumped right in the truck. And he also had his old sweatshirt in the back of his truck and the seat there for her to land, so that she had some of, you know, the owner's scent. That helped her a lot. Anyway, so she went right back in the truck, and she was a little bit nervous. He sent me a video of that, but meaning she was just licking her lips a little bit, and just a small amount of panting, and then she stopped. You know, her ears were up, so she could function. She could get in the truck, she could function, and she rode like that very well to the veterinary clinic. And at arrival, she also followed right into the building and into the exam room. I asked him to take video on his phone, and he did, of her taking a food reward from the staff, which was really impressive. I did not think that her level of anxiety would be low enough that she would still have appetite. Remember, this is a dog who would get so panicked she could not even be in a vehicle to move down the street, even with SSRI and other, you know, lots of work with counter conditioning. So, long story short, she was able to get a booster vaccination and her blood test. That day, I advised the staff to use a standing lateral saphenous vein, you know, for the blood draw, and to use a lidocaine cream, wipe over any point where there would be a needle prick, like for vaccination or also for the blood draw. And she went home, and she's doing great today. So this, by putting together, you know, all those parts of the plan of calm arrival, the client being preparing the patient, very clear communication with the client, as well as the veterinarian to staff and staff to staff, where we're going to be, what time of day, you know, make sure everything's in place. And then after action review, right? How did it all go? That's what I'm doing. I did with the client, and I will be talking to the veterinarian or emailing later in the day. Of course, they've got their whole work to do today. And so this is now this dog's plan for going in for veterinary care. And while, yes, he can, it's like kind of like wiping her mental slate clean, resetting her memory. And as with each time that she may go in for some practice runs, she's doing well, we can start to wean the medication down. So I do offer through my website, but also through another website called Stratasite, veterinarian to veterinarian, vet to vet, professional consults. So if you have a handling plan, you have a pre-med plan that you have with a case, and maybe you've used it or you're not quite sure, do I have it all together? I just want you to review it, whatever. I do offer those services. So if you'd like to email me, or you know, you can message me through Facebook, I can send you the links to those pages. But working together, especially utilizing this, you know, video call or just, you know, recorded video and sending it, and someone like myself collaborating with you, the primary care veterinarian, and your client, bringing it all together. Many of these animals who've been very aggressive or anxious for care can have safe, efficient, they were done at that veterinary office within half an hour care, and I can help you with that. So finally, last thing, this dog and her owner, they will have my low-stress veterinary care plan. I'll fill this out. I mean, I wrote the veterinarian the report after I consulted yesterday. But we need something not only for the medical record, you know, that it's concise and easy to always refer to, but I'll also send a copy of this to the client. Because now if he ever needs to go to an emergency clinic or he moves with his dog, then he's got this so that it can always stay with him, and we can use this plan wherever she goes. Thank you so much. I appreciate your interest and your help with changing the culture of veterinary care to be much less stressful and more kind, for our patients. I have a lot of handouts on my website at drsallieJFoote.com. I also have a lot of on-demand courses and other courses that you can take through my shop at drsallyjfoote.com, like the top 5 low stress handling techniques of dogs and cats, and with others in my puppy course. And lastly, I also offer different ways that I can do staff training with the veterinary technicians and assistants and with the doctors. For example, whether I come in your office and I do hands-on staff training in low-stress veterinary care and develop protocols and everything for you, or even say like lunch and learns, 1 hour of where I can present about what medications, what are these pre-exam cocktails, when do you use what and why, question answer time with the doctors and the staff to help you with this, to help you with your day-to-day care and general practice as we're also learning to utilize these things. Thanks so much and have a great day. Bye-bye.